Hey guys, today I'm going to discuss two different matters that have caught my attention over the years. One being self-diagnosing mental disorders to look cool, and two, self-medicating yourself with marijuana. Is it safe or is it not? First one I'm going to discuss is self-diagnosing mental disorders to look cool. They don't make you cool, okay? Diagnosing yourself with, let's start with anxiety. Anxiety isn't cool. It makes you scared of social situations, or scared of just certain things. Like in my anxiety, I'm scared to stay the night at my friend's house if I've never been there before. I'm also scared of using their toilets or their showers if I'm staying the night there. Really weird, I know. But, I can't help it. I'm just scared of it. Depression. Depression isn't cool. You really just lose all interest in things, and you just want to sit and sleep. You don't want to live. You don't want to continue doing things that you enjoyed. You don't want to hang out with your friends. You don't want to do anything. I'm sorry, depression is not cool. It's really a bad thing to have. And it interferes with everything. OCD, obsessive compulsive disorder. Is it fun? No. I don't have it personally, but I had a friend who had it really bad. And it drove her nuts having to organize everything or having things done in a certain pattern, otherwise she goes, ballistic. She'd lose her shit if somebody didn't do something the way that she needed it to be done. Let's see, what else is there? Bipolar disorder. Bipolar disorder sucks, okay? Say somebody were to say something real simple and they caught you on the wrong time, or maybe they didn't catch you on anything. Maybe you were just apathetic or indifferent. And all of a sudden you just scream at them because you can't help it. Like, it just makes you insanely mad and you have no idea why. It just does. Schizophrenia is a lot like bipolar disorder, but the only real difference is hallucinations or delusions. Hallucinations are not cool, okay? Let's just say this. You want to know what a auditory or visual hallucination is? Let's start with visual. Pretend you're in the Silent Hill Revelation movie, and all the things that happen in the beginning you're seeing. The nurses are chasing after you, whatever else is chasing after you. No, I don't think that'd be cool in broad daylight in front of your friends. Me personally, I am schizoaffective, which is schizophrenia symptoms with bipolar disorder. Along with, I have anxiety and possibly depression, as well as PTSD. We're not going to get into that subject, but I was at a concert, a local show for a friend's band, and my friend Krista and I were standing there. And somebody was carrying around a box with rubber band bracelets for that band. People buy one for $1 type thing. I saw a giant boa constrictor in the box, and I freaked out because it was about ready to attack me. The moment I freaked out, my friend was looking at me like, "What is your problem?" And I told her I saw a snake in the box. I'm sorry, but it's really embarrassing, honestly, for that to happen. Yeah, that was really embarrassing because everybody was looking at me like, "What the fuck is wrong with this girl? She's freaking out, about ready to scream, like somebody's about ready to kill her." Auditory hallucinations aren't cool either. A lot of times it's very common for schizophrenic patients to hear these voices telling them what to do, whether they want to do it or not. I'm sorry, but you teenagers that self-diagnose yourselves hate when your parents tell you what to do. Well, imagine that times 10 with voices that aren't even real. It's not cool. So, stop self-diagnosing yourself. Stop trying to do it to look cool, okay? If you have a mental disorder, or you think you do, go to a psychiatrist or a psychologist, get yourself diagnosed and checked out. Only a psychologist or psychiatrist professional can give you a diagnosis. And honestly, if somebody diagnosed themselves saying, "I have schizophrenia," to look cool, I would call you an idiot and say something's obviously wrong with you, but who knows what. Okay, moving on. Weed. Is it a bad thing to self-diagnose Okay, let's try that again. Weed. Is weed a bad thing to self-medicate yourself with? Honestly, if you have anxiety or depression and weed helps you, like literally makes you not anxious or not depressed, or say you have an eating disorder like bulimia or anorexia, and weed makes you eat and actually keep it down in your stomach, or if you have, insomnia and weed helps you sleep at night, or you have back pain like I do, I have scoliosis too. If it helps you but doesn't cause any severe side effects, by all means do it. Weed has never killed anyone. Weed only gets people happy, hungry, sleepy. Some people don't get hungry anymore off of it if they're major stoners, but whatever. Weed has never done anything. It is to an extent a hallucinogenic, but you have to take it in such large amounts. It's impossible to actually hallucinate, really, unless it affects you in a negative way. Now, if it affects somebody in a negative way, then they shouldn't do it. There's no doubt about it. There's no argument. If it doesn't help you and it only makes you worse, don't do it. Unless you're fucking retarded. If you're gonna sit there and smoke weed when it makes you violent or hallucinate or paranoid, then you're probably a fucking idiot. Sorry, that's just my opinion. Anyway, that's the discussion for today, and I hope you guys enjoyed. Please subscribe if this is your first time seeing or you haven't subscribed yet. And let me know what you think in the comments. If you're going to hate against it, please keep it civil. I can't talk today. Anyway, have a good day. See ya.